So in this video, I was kind of thinking to myself, I need to try and get as many, as much facts as I can get my hands on to try and ease people's anxieties about the coronavirus situation. So this video is not going to be about my beliefs about coronavirus. This video is going to be for people that are very convinced that there's a deadly virus going around. This is for those people. I just want to kind of help people out there. Because it can be quite a scary situation. So anyway, just to try and put things into perspective, if you look at there was one woman at the White House asked how many people that died of COVID-19.
For Dr. Ezike, how many have died from COVID-19 that do not have any other underlying health condition?
So nationally, the numbers are vanishingly small. In less than 10%, I think I saw something like 6%, and that might have been global numbers. So in the general statistics, Illinois has been similar to what the aggregate larger numbers.
The chances of you getting COVID is very low, and then also if you do get COVID, if you do test positive for COVID-19, the doctors say that it's usually 80% of people that test positive show mild symptoms. So it's not extremely intense or severe usually, right? So some people might be unlucky; they might end up having pneumonia, or they might die. And also, they thought, they thought that the death rate would be 3.4%.
We were led to believe that the mortality rate was going to be 3.4%. Devastating. Now we know with a great amount of certainty it's well below 1%. But there's another shocking trend emerging. How COVID deaths are being counted. Now just today, Colorado lowered its death toll by nearly 20%. Now how did they do that? Well, they simply separated people who died from COVID from the total number of people who died with COVID. Get it? Now, that's not to diminish any deaths. They're all horrific. But if public policy is being based off these numbers, the public needs the right.
These big, huge figures, these big, huge numbers, right, on the screen. The reason why there's so many thousands upon thousands of COVID deaths that you see on the news, on the statistics, it's mainly because there's to try and explain why that is the situation. Dies of COVID. I mean, if they die of something else, but they tested positive for COVID-19, let's just say, for example, if they died in a car accident and they had COVID-19 in their system, then that will get calculated as a COVID-19 death.
If someone dies with COVID-19, we are counting that as a COVID-19 death.
Right? So this is just to help you to see things realistically. It's just so you're not freaking out too much when you see those big, huge figures. Because it could scare a lot of people, and also they've been known to double count the numbers as well.
A stunning spike. Late today, New York City abruptly increased its death toll by 3,700. City officials say the total is now more than 10,000 because they're now including people who'd never tested positive for COVID-19. But we're they tell you this just to get you a better understanding of why you see thousands upon thousands of COVID deaths. Like for example, Italy, the COVID deaths, 96% were usually of other illnesses, but they might have tested positive for COVID-19, so we don't know if maybe the virus had helped the person to die quicker,
we don't know. And also, one of the things that you notice with the PCR testing technique, it's not 100% foolproof. It doesn't completely prove that the person. So if someone tests positive for COVID-19, it doesn't necessarily mean that they've completely got it. Because it can be kind of hard to know if the PCR. It's only meant to be around about. I'm not sure about the percentage, but it's not 100% foolproof, if you know what I mean. It usually gets used to aid. It aids in diagnosis, but it's not like 100% foolproof, if you know what I mean. Because you can precautions, a bit like hand washing. Like I like to wash my hands and stuff like that. These are just. It's just in case that maybe you had the virus on you, or maybe on your hands or whatever, and just. You need to think of it like that. So, I mean, I quite like the lockdowns, me personally. I quite like the social distancing. I don't like the masks very much, but I do like the social distancing, and I like the lockdowns as well. It makes the streets very quiet. I like peaceful streets. Yeah. So we'll be having another lockdown in November in Britain. I don't know if it'll be all of Britain, but we'll be having another lockdown from someone that works from the government I know. So well, I don't really know them personally. So I can't wait till the next lockdown. Can't wait for that. And also here's another thing here, just as quickly from another source. It says here that, but a recent meta-analysis confirms earlier estimates, finding that the death rate can be as high as 16% for people over 90. See, one of the things, right, is a lot of COVID-19 deaths is usually a lot of it was associated with people with underlying health conditions as well. So if you've got quite good health, and you've got strong immune system, like one doctor says, if you've got quite good immune system, you may not actually need a vaccine. So the vaccines are just for people that really want a vaccine. It's like I don't want one, but some people might want to have a vaccine. That's up to them. But anyway, hopefully this makes sense to people, and bye for now.